Hi, I'm Elizabeth Schilling. I am an equine veterinarian, and I am here to talk to you a little bit about veterinary medicine, to show you a little slice of what we might see in a day, and to talk about how the various STEM disciplines apply to it. So if you've ever thought about being a veterinarian, this is what most of my days look like. I work primarily on dentistry. And so that might be standing out in the middle of a field. It might be in a barn. I do some work in small animal dentistry as well. So that happens in an actual veterinary clinic. So in veterinary medicine, there's all kinds of possibilities. We tend to think of veterinarians as dealing with puppies and dogs all day, but there's really a huge variety of careers within the profession. And so we might see veterinarians in clinical practice with horses, dogs, cats, cows. They might work on sheep and goats. We might work in zoos. We also, over here on the right, we can see veterinary researchers. So veterinarians tend to be involved in a lot of basic science research and medical research, as well as teaching. And so obviously, in order to train new veterinarians, we have to have veterinarians teaching them. So today we're going to just talk about a sample case and kind of work through it. And we're going to see Freddie, who is a thoroughbred gelding. So thoroughbreds are horses that are bred for racing. If you hear about racehorses, and Freddie, in fact, used to be a racehorse, but now he just hangs out and lives the life. And so Freddie has a problem in his left front foot, or his left front leg, this morning. So we're going to go meet Freddie. Hi, bud. So before we look at Freddie and try to figure out what's going on, we have to think about where his problems might be. So we need to understand biology and understand what structures normally make up the skeleton and the other parts of the horse, and what he needs to be able to walk normally before we can figure out what might be wrong. So those structures that we're going to be concerned with would be the bones, muscles, nerves, ligaments, and tendons. You may have heard some of those terms. Certainly bones and muscles are pretty obvious. So the nerves are what controls the movement of the muscles, and tendons and ligaments are what attach bones to each other and attach the muscles to the bones, and the nerves control that movement by causing the muscles to contract. And so we might think about what problems could be involved in Freddie having a problem walking. And so if we think about each of those sets of structures, there can be problems in each of them, right? There can be fractures or bruises, or even just strain on the bones. There can be strain or injury to the muscle. There can be damage to the nerves or ligaments or tendons, and any of those things could result in Freddie looking like he has a lameness issue. We watch Freddie trot, and we can see that when his left front leg goes down, you can see it a little bit better in slow motion. His head is up higher when the left leg is on the ground than when the right leg is going down on the ground. And you can see it even more when you see him coming towards you like this. And so when he's raising his head, he's trying to take some of the weight off of that left leg. So that tells us that the problem is in the left leg. So we want to think about the anatomy that we're going to be concerned with in trying to figure out what's going on with Freddie's legs. So if you think about it, we all mammal species have basically the same anatomy, just in slightly different proportions. And so we look at the foreleg of a horse or a dog, and those are the same bones that we find in our arm. And then the bones in the back leg of a dog or a horse are the same as the bones that we find in our own leg. So for today, we're focusing on Freddie's front leg because that's where we see he has a problem. and we're going to see if we can't figure out what's going on with him. And we're going to use a tool called hoof testers, which allow us to put a little bit of pressure on the hoof to try to find out if there's an area that's sore. But when we're doing that, we find something that doesn't look like it should be in there. And that looks like maybe the head of a nail. So if we look at the horse's distal limb, or the leg, the part of the leg that we're worried about, we're looking at the same bones that we have in our wrist and hand. And the area that we're concerned with Freddie is down in the hoof. And so the horse's hoof is down here. And so this is actually the same bone as the tip of our finger. So these are color-coded to show you that really we have very similar bones. The difference is that we have 5 fingers on our hand. Dogs and cats typically have 4 to 5. And in horses, they just have 1 finger. And so we're looking down here at the bone at the very bottom of his leg.
So we saw in the picture that we have the same bones in the end of the horse's foot and our finger. So let's look inside and see the relationship there. And so you can see how the coffin bone is right inside the hoof wall, and this is all the part that we can't see from the outside. So we know we want to figure out where the nail went. So if the nail had gone into the coffin bone, that can cause a really serious infection in the bone, and that would be very serious for the horse, and that would necessitate big surgery to fix it. If the nail had gone through the digital flexor tendon, which comes down here, and this space here is the coffin joint, if the nail had gone through there into the coffin joint, that would also be very serious because you would have an infection in the whole joint. And both of those situations could lead to the horse needing to be euthanized. If the nail had gone into the digital cushion, this is just a cartilage type tissue, and that's not as big a deal. It's a more minor surgery, and we don't have to worry as much about the long-term use of the horse because this is more apt to heal. So the next thing we want to do is figure out where in Freddie's hoof that nail is.
So we want to think about how we're going to figure out where this nail is, and we want to think about how we look inside the foot. And we can do that with x-rays or radiographs. And so the x-ray is the actual beam of energy that we are going to put through the foot and try to capture an image with it. So x-rays will give us information about bones or metal or fluids. But it doesn't give us any information about tendons, muscles, or ligaments. So we know that there's bones in the foot, and we know that the nail is metal, and so we should be able to see what's going on there. So when we think about the sciences that we use here, we definitely have to know anatomy, and that's part of biology. We have to know how to aim the x-ray. So this picture up here on the right is actually a picture of us doing ultrasounds. So if we're looking at a problem in a tendon or a muscle or a ligament, we can use ultrasound to get a picture of it. But for bones, again, we're going to use x-rays. So both of these modalities of imaging rely on a knowledge of physics to know how we get the image. And we have to understand geometry in being able to put the beam in the appropriate position to the leg. So we have to know the angles, we have to know the shapes and the planes of everything and be able to translate that. So we're going to bring the x-ray plate and the machine over to his leg. We're going to fire a couple of images, and then we can look at them, and that can help us decide where in the foot this nail is. So this is what we see. And so we're going to have to figure out if this is a big problem or a little problem. It sure looks like this nail is going straight into the bone, but we have to remember this is just a one view. This is just looking from one angle. And so what we do is we take views from multiple angles of the leg. And so we take views from the side of the leg and from the front of the leg, and sometimes from different angles as well. And so that can show us, here we have that first image that you saw, where it looks like the nail is right into the bone. But when we look from the side, we can see that it actually is back in that digital cushion, and it completely misses the bone And we know that that tendon goes right down here. So it looks like it's completely missed the tendon also. So this is pretty good news. And this is telling us that we're going to have a much better chance of being able to fix that. So we're going to need to give Freddie some medication so that we can do some surgery to remove this nail. We can't simply just pull it out because we need to also remove some of the damaged tissue so that it can heal properly. So we've got to think about pain, obviously. We're going to have to worry about infection because we have a nail that's gone through the dirt that's in his foot and into the cartilage. And so we're going to have to remove that tissue that's damaged. And then you may have heard of tetanus, but this is a bacteria that is it's everywhere in the soil, and so any wound that is potentially contaminated with soil has the possibility of bringing tetanus with it, and so we're going to have to deal with that. So we need to understand chemistry and physiology and anatomy. So we know that pain travels on nerves, and we know that there are portions of the nerves that receive the signal that tells the brain that there's pain. And we know that we have chemicals that can stop that signal from going up the nerve to the brain. So we're going to use some of those medications, and then we need to figure out how much to give. So we know that Freddie's about 1,100 pounds, and all of the medication doses that we deal with are usually in kilograms. So we need to understand the metric system. So we're going to need to figure out how many kilograms Freddie weighs. So we know that 1 kilogram is 2.2 pounds. So we can divide 1,100 pounds by 2.2 pounds per kilogram and get 500 kilograms. And then we know that we want to give him 4 milligrams for every kilogram of his body weight. And so we need to figure out how much that is. And so if we take his weight of 500 kilograms and we multiply that by 4 milligrams per kilogram, then we get to a dose of 2,000 milligrams. And then the next step is that we know that each tablet that we can give him has 1,000 milligrams, and that's 1 gram of pain medication. So we want to figure out how many tablets he needs. And so we're going to take that 2,000 milligrams that he needs and divide it by 1,000 milligrams per tablet. And we figure out that he needs 2 tablets twice a day. So then you should be able to figure out 2 tablets twice a day is 4 tablets per day. If we figure out how many days he's going to be taking it, then we can figure out exactly how many he's going to get. We're also going to give him some antibiotics because we know that we have contamination, so we're worried about infection. And again, chemistry tells us what chemicals will kill the various bacteria that we're dealing with. So we're going to use one called trimethoprim sulfa, and we know that we want to give 20 milligrams per kilogram of body weight. We're going to do that twice a day. So we know that Freddie weighs 500 kilograms, and we multiply that times 20 milligrams per kilogram. And so now we know that he's 10,000 milligrams. And so again, if each of these tablets has 1,000 milligrams or 1 gram, then we can figure out how many tablets he needs. And so 10,000 divided by 1,000 is going to be 10 tablets twice a day. And again, we can figure out how many tablets he would need to have for, say, 5 days. 10 tablets twice a day is 20 tablets a day times 5 days is going to be 100 tablets. So we can get that all set. So we typically give horses these medications by putting it in a syringe and sticking it right in the mouth and squeezing it and getting them to swallow. Sometimes we're lucky enough that we can mix it with a little bit of something sweet, like applesauce or pancake syrup or something like that. Some horses like yogurt, and we can mix that in with some of their food and they can take it that way. Otherwise, we stick it in their mouth like this. We're also going to give Freddie a tetanus vaccine, and so that's going to help prevent the problem of tetanus. Most horses are well vaccinated for tetanus, but when they get a wound, we give them a booster shot anyway. So Freddie gets better. We got the nail out of there. We cleaned out the infected tissue. We gave him some antibiotics. We gave him some pain medication. We kept it bandaged, and he's feeling pretty happy again. And so he's having a good time out here. So that's just one example of a case. We see lots of other cases. We might be dealing with animals that have coughs, or they might have some more serious diseases. They might have a problem with their intestines. All the same medical problems that humans can have, animals can have those same problems too. And so veterinarians see a wide variety of cases. And again, not all veterinarians are in clinical practice. Some are in research or teaching, and we even have veterinarians that are members of Congress and in other parts of government. So the field is a huge field. There's all kinds of ways you can go with it. And if you have any questions, I'm more than happy to try to answer them. And you have my email down here. So I hope this has been a little bit fun. I hope it's been a little bit informative. And if you were thinking about being a veterinarian because you like dogs or kittens, that's great. But I hope you can see that there's lots of other parts of the veterinary world also, and maybe you'll consider those. So I hope you have a great day. Thank you.